We've heard health experts saying there are two specific groups at higher risk for COVID-19, our seniors and those living with serious underlying medical conditions. But today, a provincial health leader mentioned a third group, those living in low-income neighborhoods. It's what Black health leaders have been saying for years now, calling on the governments to collect race-based data, asking the question, who is being left out?
If you look into the evidence from the United States, there is a variety of factors about who people are that actually is very strongly associated with their likelihood of getting infection.
In several U.S. states, disaggregated data points to African Americans and Latinx communities disproportionately impacted by COVID-19 deaths and cases. Health experts here in Ontario have asked the government to collect race-based data to get a better understanding of how the virus is impacting all communities, especially those that face poorer health outcomes, higher rates of poverty, and systemic barriers. In the provincial health briefing this morning, the dean of the Dalai Lama School of Public Health at the University of Toronto says there are a number of ways to consider collecting data on how this disease is spreading, population and geography.
People living in the same community are at higher risk if there's a case than people in a community where there's no case. The other way you want to look at it, though, is in terms of different groups of population. And so if we look at, say, people living in low-income neighbourhoods in Ontario, they are now at a higher risk of infection and cases.
Just recently, about a dozen Black health leaders penned a letter to governments highlighting the growing disparity and marginalization of communities in Ontario, both racialized populations and Indigenous peoples, saying race is a determinant of health and calling for critical analysis of which communities are at increased risk of harm. It is up to each province and territory in Canada to decide whether or not to collect data based on race. We asked Premier Doug Ford why the province isn't gathering this information, monitoring situations based on the highlighted risk factors.
Well, first of all, I don't believe per se the race-based data, but I do believe in postal code data. And you look at regions and you can look at the communities, and some communities are lighting up like a Christmas tree. And what that allows us to do is reallocate the resources, reallocate people to make sure that they're informed and they get the information that is needed.
To this response, Black community health leaders asked the question, how will postal code data determine whether or not a community will require more COVID-19 testing? Also adding that there are neighborhoods and areas that deal with a wide range of barriers, including precarious housing and unemployment. At Queen's Park, I'm Faiza Amin for City News.